on and do a live on YouTube every Sunday night so I can answer your questions. And the timing may change a little bit, but I want to be consistent with this so I can be there for you and here to answer any questions that you guys have regarding my skincare line or just any skincare line or anything related to dermatology or skin health or aesthetics, whatever you guys want to ask me about. So I'm here doing a live for you guys. I'm going to be on for about 30 minutes. So whatever questions you guys have, they'll pop up here and I'll be able to answer them. And then I'll post it later for anybody who missed it or wasn't able to attend or join us. So I do this on my Instagram channel, on my Instagram feed, and I want to do this for my YouTube family as well. So it's good to see you guys. Hi. It's so nice to see everyone here. And I don't know if you guys could see the questions pop up, but if I don't get to everybody's questions, I'll make every effort to. And if I don't, then maybe just keep asking the same questions and I'll see it pop up here. And then if I happen to not see it or I can't keep up with all of the questions, you can also just keep a comment or write a question in the comment section and I'll go ahead and answer you there. So usually Sunday is the best day for me to do this. I do my IG lives on my Instagram on Fridays because when the work week hits, I'm in the clinic seeing patients and doing treatments and I'm not on my computer. So I do usually get back to everyone on my social media accounts over the weekend. A lot of time to catch up. So just bear with me. I'm here for you and I want to answer your questions. And hi guys. I want to hear what you guys have to say and answer all your questions. But if I don't get back to someone, I don't want you to get discouraged because I always will get back to you. It just may take me a couple of days because I'm not really a YouTuber. I'm just a physician who YouTubes. So if you guys have any questions at all, just let me know. And I hope you guys are enjoying the skincare line MDR. If you guys haven't tried it yet, you should go ahead and try it because everybody's loving it. The technology is next level. People are having amazing responses. I'm seeing patients come in my clinics who've been using the products now. We just launched less than 2 months ago, but it's great to see everybody coming in with this like beautiful flawless skin without the need for makeup. So it really means everything to me, and I'm glad that I can share this with you. So hi guys, it's so good to see everyone on here. This is so fun. So I'll try to keep up with hopefully I'll try to keep up with the questions, but again, if I don't get to someone, just keep asking the question. So somebody asked, can you explain why MD Air, oh, it went away. Can someone, I have to get better at like checking these. Okay, can you explain what makes MD Air so different than other medical grade skincare lines? Well, I'm glad you asked. So MD Air, the line, is engineered by myself. So I think the difference is that, you know, I'm the formulator, I'm the scientist, and I'm the dermatologist behind it. And I kind of just cut out the middleman for production of a skincare line that's the most innovative technology direct from the source. So what motivated me to start my own skincare line is that, you know, after 20 years of school, including, 4 years of medical school, internship in internal medicine, 4 years of dermatology residency, then post, graduate fellowships in Mohs surgery, which is a skin cancer surgical fellowship, and aesthetics fellowship. I mean, I have a lot of derm knowledge and education, and I was approached by different skincare lines asking me to be their scientist or formulator so that they could mass produce, skincare products for companies. And I thought to myself, like, why would I do this? Why wouldn't I directly formulate it for my patients, coming from my brain to my patients, to their skin with outcomes based, results. And I'd always been thinking of it because, learning what we do, exactly what active ingredients the skin needs, what vehicle delivery systems, how to get them there, how to keep them molecularly stable. And we're continuous learners. I just recertified my boards the other week. You're always getting access to novel pathways and new information and new technology. And it's such a rapidly advancing field that by the time a skincare line hires somebody like me to formulate for them and then they get it into mass production, it's like years before they can't ever keep up with the technology. So I remember being at the American Society for Dermatologic Surgery, which we call the ASDS. It's one of our scientific meetings, and there are thousands of participants there, and there are always these big lecture halls where they have different courses going on. And I always go to the super nerdy, super scientific meetings that are like way down the hall in the little small classroom. Everybody's like in the Botox and laser huge venue, like trying to learn how to do lasers and Botox and fillers and all that stuff. And which I'm good with that. I don't need to learn how to do that anymore. I got that down. But I would go to the scientific sessions where these amazing scientists with these amazing brains would tell us about the new technologies, the new pathways that they've discovered, the new active ingredients that we're going to see in the future in skincare lines once they become mainstream. And I remember talking to the scientists. I was taking notes on my phone, and I talked to scientists, and I said, why is it going to take years before we see the skin lines have some of these active ingredients, or some of these vehicle delivery systems where you're spinning electrons and doing all these really cool things? I'm like, why isn't it happening like tomorrow? And like by the time it becomes to production in the skincare industry, and I'm like, well, by the time Kim Kardashian comes out with her line and figures out what she needs to do by hiring a scientist, I'm just like, I want it to change with the times. I want to be 5 years ahead of everyone, and I want the technology not only with the active ingredients that are new to the game that will change the game, but also novel vehicle delivery systems and stabilization chemistry that will make the active ingredients that have stood the test of time that we already know work even better. So that was what my motivation was. I was impatient and I didn't want to have to wait, and I wanted to provide something to my patients which I knew had my finger on the pulse, exactly, the most innovative technology, and to be able to change with the times, not to have to find out, what's new and the advances and innovation, and what is the new active ingredient now that we should be knowing about. I want to take it directly from, that's why I call it the translational skincare line, because we take it directly from what we're learning in the lab and learning in our discoveries of research into a skincare product. And the interesting thing is a lot of discoveries were made during COVID, because the COVID, coronavirus affects, as you know, multi-organ systems in different ways, and so we learned a lot about the aging process, and we learned a lot about telomeres. We learned a lot about a lot of different pathways and a lot of different things from COVID, and ways to reverse those pathways from happening so fast have really potent, actually, anti-aging benefits too. So everything's kind of interrelated, and hearing these, derm lectures about what we've learned from the coronavirus and the aging pathways, and AIR is one of the pathways. So AIR stands for the antioxidant response element, and the little I means induction of. In science, whenever you see a little I, it means induction of a pathway. So that's why I named it AIR. There was a name that was close, so anyway, I put MD on it because, it was engineered by a physician. So just to kind of make it separate from other things with a similar name. So, I really think that and I will change with the times as we, have new discoveries that are made in dermatology and skincare and cosmeceuticals. I'm going to stay ahead of the game, and I'll keep you guys there with me. I want to be able to provide just the latest and greatest technology. And if you guys have used the products, you'll see that, the vehicle delivery system, when you put the vitamin C on, it's gone. It doesn't sit on the surface of the skin. It gets, transported down to the epidermis, the papillary dermis, the reticular dermis, and it activates fibroblasts. It activates different, cell types in the epidermis and the dermis to, turn on these other anti-aging pathways. So I can't talk enough about it, and I don't want to, take up too much time talking about the brand, but that has a lot to do with it. So I'm really excited to share with you guys, bit by bit and little by little. But I would have to say the thing that makes MD Air different is that it's engineered by me for you, and we're ahead of the game with respect to staying on top of the technology, which is always changing, and you have to adapt with the changes because things just keep getting better and better. So that was a long answer to your question, but let me see what else I've missed. I've missed out on so far. Vitamin C, then growth factor. Yes, so vitamin C always goes first in the layering of products because it needs a certain pH and lipid profile, water profile for it to remain stable and in its most active form. So always put on your vitamin C first, and then you can put growth factors on top of that, or your hydrator, then your sunscreen, and then your makeup if you wear it. But probably most of you, like me, don't have to wear makeup because your skincare game's on point. But I think that growth factors you should put them on after the vitamin C. Okay, let's see what other questions I have. Okay, so what can I do at home to get rid of age spots on my hands and arms? So at home, I would use brightening or lightening creams or serums, non-hydroquinone skin brighteners, including AHAs or BHAs, vitamin C. I wouldn't do some of the, DIYs that you can see like on TikTok or online, including like lemon and, toothpaste and all different crazy things, because you can cause an irritant dermatitis with post-inflammatory hyperpigmentation afterwards. So you don't want to worsen everything. I just remind myself I have to not talk too fast. I'm going to work on that a little bit. But brown spots, of course, wear your sunscreen. Wear your sunscreen when you're driving, because that's usually the time where you're getting a lot of sun exposure to your hands, the dorsal aspect of the hands, which can, cause those age spots and those brown spots. But if you have a hydroquinone, that you like, the ZO hydroquinone is a really great one. But if you want a better price point, you could get like a vitamin C or AHA or BHA that has, kind of like a lightning effect by not inhibiting the melanin synthesis pathway, but by desquamation of melanin that has kind of gathered and collected in different, age spots on the skin. So it's hard to, have great results with just using at home, but, I think the best things are sunscreen, photo protection with, wearing gloves when you're in a car, have some driving gloves. I have them in my car. And then using, some non-hydroquinone skin brighteners. So medical grade's usually best. And if you have like a ZO, skin health hydroquinone kit, that's amazing. Lightera 2.0 by Skinmedica is another great one. Even Tone by Skin Better Science is another great one too. But you want to be able to reverse the brown spots, but prevent future brown spots from happening too. So that's always important to remember. Okay, so let me just see. Okay, do you like toners, or do we need them? Do you use one? So I think toners are underrated step in skincare, in a skincare regimen. You don't have to use them, but if you find a right toner, toners are really important because what they do is they downregulate sebaceous glands in the skin. So I use the Complexion Renewal Pads by ZO. I also use the Alpha Ret Peel Pads by Skin Better Science once or twice a week. And what the toners do is it decreases the activity of the sebaceous glands. Sebaceous glands produce sebum, or oil for the face, which is actually not a good thing. So there's commonly a misconception, and I even had this misconception my first year residency until I learned the reason why. And sebum and oil is not good for your skin. I remember Dr. Zaino Baji would say, oil and sebum is like toxin for the skin. It creates dilated pores, it creates open comedones, which are blackheads, it stretches out the pores, and it just makes skin have a terrible texture. It upregulates the matrix metalloproteinases enzymes, which break down collagen and elastin. So you don't want oil sitting on your face. So toners tone that down, and they shrink the sebaceous glands. So if you look under the microscope, sebaceous glands are the oil producing glands in the skin, and they look like these little white fluffy clouds under the microscope. People who have been using a toner, this doesn't have to be every day. I use it twice a day, but it doesn't have to be every day. Even if it's just a couple of times a week, it shrinks those sebaceous glands down. And when you shrink the sebaceous glands down, the pores get smaller, because when the sebaceous glands spread, it spreads the follicular ostia, which is like the opening of the pore. If you look at it on cross section, it looks like this. And the sebaceous glands, when they get bigger, they spread out the pores and can widen the pore size. So for all my patients who are using like oils on their face, and I see them in my clinic, I mean, I'm never gonna, if you're a patient of mine, you know this, I'm always like go with the flow, and I always want you to use what you feel comfortable with. I don't want to be too persuasive with changing your whole routine. If you have something that works for you and you like it, I say just leave it. And if it's working for you and it makes you happy and your skin seems to tolerate it well, then that's great. But for people who are using oils, or there's a lot of medical grade skincare products have a lot of oil in them, and what it can do is cause dilated pores and blackheads. So once I tell patients to substitute that out for something else, or to use a toner, they come in with these tight little pinpoint, barely noticeable pores, and their skin just looks glassy, and it without fail, I mean, I see hundreds of people in the clinic every day, so this isn't something that I see it in real life, and I'm like, wow, when people stop, using oils, or they start using toners to downregulate sebaceous gland activity, they really transform their skin into the more glassy, poreless skin that is ideal. So you don't need big active sebaceous glands for healthy skin. Remember, your skin needs water to hydrate, not oil. I always tell my patients this, and when I teach the derm residents, when you're at the gym and you're working out, you don't grab your hydro flask full of oil, you grab it full of water and you hydrate yourself. Cells in the skin are just like cells in your body, they need water, not oil to hydrate. So yeah, I think toners are a great thing, and if it causes a little bit of sensitivity, just work your way up to it, and maybe start with once a week and then increase it as tolerated. Okay, let's see. Can you do before and after pics from people using your line for a period of time? Would love to try. Yeah, I definitely will. I mean, we only launched like 5 weeks ago, so I want to have, at least 3 months of use. And I do have some before and afters of people who have been using it for 1 to 2 months and they look amazing. But also under the microscope, we're going to do skin biopsies with trichome stains, immunoassays, all the things. Like, I'm all about science, and that's the other thing with my line. I don't have to like hire a scientist to see if it's stimulating collagen. Like, I know exactly which collagen stains I want. I know what kind of biopsies I want. I have a pathologist who I work hand in hand with. So, it's really fun to like run assays, and you see clinical improvement, but then looking under the microscope at the skin and seeing the differences, it's just so rewarding. And it's so fun. Like, I love to do it. And I've just been looking at skin under the microscope and correlating it with what I see clinically my entire career for 15 years. So it's just really fun to be able to formulate something and see a histological change that correlates with a clinical change and a result that you can see in clinic, which is really really rewarding. Okay, so let me just make sure I didn't miss anybody. Okay, so what do you think about red light therapy? I like red light therapy. Infrared, red light therapy, some of those masks can be so expensive. I don't know if it's 100% worth it because it's time consuming and it's expensive. If you go to your esthetician or you get a medical grade red light or like a light stem, and you have somewhat of an effect, that's a lot more powerful than the time and money that you have to spend doing it at home. But I mean, it can't really hurt you. I've actually seen one patient get like a little bit of a chemical burn, but she'd been using AHAs and BHAs and putting her red light on, and she actually got a pretty bad irritant dermatitis. But for the most part, they really can't hurt you, so I'm all for it. It's just really expensive, and I'd probably rather have somebody spend money on something that like is longer lasting and something more substantial. But to each his own. If you guys have red light devices that you use at home when you like them, I'm all for it. There's certain other devices that I'm not a big fan of, but it just depends. I say if you see a difference, then great. But if it's just a placebo effect, like you're like, I think it's working and it makes me feel like I'm doing something, then that's a whole different story. But as a dermatologist, I don't want to promote things that aren't going to work, because that's my reputation on the line. If I say yes, red light masks are amazing and they work, and they're like, I don't see a difference, and Dr. Keppel said that they worked and that's why I bought one. Like, I don't want to be responsible for that, so I can't really recommend them because I have not been impressed, nor have I been impressed by the data in the peer-reviewed literature or at our academic meetings either. Okay, so your thoughts on Evoke and Evolve hands-free radio frequency treatments. There's not that much data supporting it, but like I said, if anecdotal evidence shows that it does have some improvement, again, I don't think it can hurt you. So as far as looking at peer-reviewed literature in our data, it's not very supportive, but if it can't hurt you. So if you're getting a good response and you like it, I say it's totally fine. I wouldn't recommend it to a patient though. What is liquid facelift? So usually liquid facelift is what people refer to when people use fillers to kind of like lift the face when you have like sagging skin or like volume loss. I'm not a big fan of liquid facelift, or if somebody needs that much filler to lift the face, I feel like they should use a tightening device or a thread lift, or go see a plastic surgeon, hopefully not. But usually, fillers should just be like a little adjuvant that you use for your face when you want a little bit of lip enhancement, or a little nasolabial folds, or marionette lines, or if the temples are sunken, but not like all over pan facial. I'm not a big proponent of that, but a lot of providers do. They just basically do a facelift with filler. I'm more of a device girl. I'm more like a laser girl. So I'm always like tightening and stimulating collagen synthesis to lift, tighten, and pull from within, whether it's an energy-based device or a laser, because that way you're inducing your body's own regenerative processes. You're enhancing your skin. It's like working out for your skin to tighten and to lift and to do the work, not just by passively putting a bunch of filler in it. So that's usually what they mean by liquid facelift. Let's see. Okay, what's a good cleanser and or toner for my 13-year-old daughter to keep her pimples away? Oh gosh, so I really love Zio. You guys probably see I post on that all the time. They have a 3-step protocol called wash, scrub, oil control. So the cleanser is the wash, and then the exfoliating polish is like a mechanical scrub, and then the complexion renewal pads or a toner with AHAs and BHAs that help shrink down pore size and eliminate the P. acnes bacteria. I have a little 11-year-old boy, and he gets little inflamed keratosis pilaris on his cheeks, and all I do is a complexion renewal pad swab on him once a week, and I have him see Danny, my amazing esthetician. But if she's 13, I would just start with maybe like the complexion renewal pads by ZO, and just, use it maybe once or twice a week, and that should help. And just make sure she's washing her face, twice a day if she can. The Gentle Cleanser by ZO is great. The Oxygen Cleanser by Skin Better Science is another good one. It has oxygen in it, which helps detoxify and purify the skin and decrease the P. acnes bacteria that can cause mass knee and acne, but that might be a little bit too irritating for her. So, if you wanted to try just like an over-the-counter like benzoyl peroxide, I would get like one of like the 2.8%. I think Clear Pore by Neutrogena is a good one, and just something that's less than 5% for her, her soft, little baby skin face, because if she's 13, you also want to be mindful that her skin might be a little bit more sensitive to irritation. So benzoyl peroxide is one of the best like over the counters, but I like the more elegant medical grade better. Like even the Gentle Cleanser by ZO is a really, really great one, like I said before. So, but just trying to give you like options like medical grade and drugstore too, because I know that some of these products can be a little bit pricey. Okay, hi guys. All right, let's see. Okay, let me see. Awesome, thank you. You guys are so sweet. I'm just like getting all the highs. Hi. Okay, let me see. Oh, thoughts on Eloqua microcoring. Okay, whoever asked this is up on their research. I love you. You get like A+ honors. Okay, so Eloqua microcoring. If you guys don't follow, if you follow me on Instagram, hopefully you follow Dr. Matt Avram, who's the director of the Harvard Cosmetic and Dermatology Clinic at Mass General and at Wellman Labs and at Harvard, where they do most of the clinical trials for these up and coming devices that usually change the game. So microcoring is probably coming soon, but down the pipeline in about 1 to 2 years. It's not like microneedling, and it's not a laser. It's like kind of like this hybrid. You basically take microcoring. You should take up like thousands of pore punch biopsies out of the skin. So it sounds barbaric. I actually participated in the clinical trials when I was just a fellow. I was pregnant with my second baby, and I was in fellowship. And these geniuses from MIT came with this big device. Like, it was so fun being at this laser center because all the clinical trials happen there. Before you see the sleek little sexy lasers in the clinic, they start off as these big crazy machines hooked up to DOS, and you have these like these amazing brain geniuses who are typing these DOS keywords into this big platform for this device to make it work. And then as it evolves and as you get the certain settings and the diameter of the treatment area and the heaviness of the handpiece, all these things get calculated and come to fruition over years of clinical trials and use. But I used it back like in 2015, 16, I think it's 17, and the results were amazing then. So I can't only wait to see what it's going to be now that it's been a couple of years, and it's probably another year or two. I actually asked Dr. Avram just the other day when it's going to be available, because I might fly out to Harvard to look at this device and see what it does and what the results are now. So what it does is it basically takes microcores out of the skin. So think of like taking a piece of skin and making it into Swiss cheese and then closing the holes. So you take like a Tegaderm and you shrink up the holes after taking pieces of skin out. So microneedling is basically just taking little pinpoint pricks into the skin, but microcoring is taking circular chunks of skin out, like punch biopsies, and then shrinking all the tissue back together. So it has amazing results for tightening. For some reason I lost my connection, you guys. Hopefully you're still there. So great question. So Eloqua, that's going to be coming up soon, probably in the next year or two, or maybe even sooner. And I'll be the first to keep you guys in the loop with the technology regarding that device. Let me see. Oh my gosh, yeah, somebody said I like the white flowers on the side. Oh my gosh, how funny. My house is probably messy, sorry. Okay, let me see. Thank you for the compliment though, I appreciate it. What made me go into dermatology? So that's a great question. I knew from my first year of medical school that I wanted to go into derm. I did one rotation with a dermatologist, and I just thought it was like the coolest specialty because, you're basically seeing patients in real life, clinical, and correlating it with what you see under the microscope. And it's a very visual specialty. You know, you can't look at a patient and see that they're hypertensive or know what their blood pressure is, but you can know if they have psoriasis versus epidermolysis bullosa versus, tinea curis versus, any other dermatologic entity. It's really cool to see, skin in a clinical sense and just know what test to order, or what labs to do, or if you should do a skin biopsy or not. And then just to visibly see your patients and see the outward manifestation of systemic disease, things that are going on inside, was really fascinating to me. And then to correlate it to what you see under the microscope was really, really interesting to me too. And I went to medical school wanting to be a surgeon. I had a lot of surgeons who inspired me growing up, women physician role models in my family. And I knew I wanted to be a surgeon, but I also knew that I wanted to have kids and be a mom and have a family too. So I thought that it was really cool that dermatology had a lot of outpatient and procedures done in the office where your patients didn't have to be under anesthesia and you were in an OR taking overnight call and things like that. So I really loved the procedural part of it. I love the surgeries, working with lasers, working with injectables, making that clinical histologic correlation. And it was the hardest specialty to actually match in. So I don't know if you guys know this, but derm is probably the most competitive specialty because they keep the supply low and the demand high. So in every residency program, in my residency program at UCLA, there are only 3 of us versus like internal medicine, there's like 30 of them, and there's a lot more internal medicine residency programs across the country than there are derm programs. I think there were only 8 or so derm programs when I applied in California, which is where I'm from. So it was also good to go for derm because you knew that if you wanted to change your mind and go into any other specialty, you had to have like the top grades and the top score in your medical school class in order to match there. So I knew that you shoot for what is the saying? You shoot for the moon, and if you don't make it, you land among the stars. So it's like I knew that I'd be able to match into anything else if I went for derm in the first place. But it really was stressful because medical school's hard enough as it is. You're in your early 20s and you're just basically working 80 hours a week and you're studying. You have exam after exam after exam, and they're with some of the brightest people in the country. I remember looking to my left and right, Ivy League Rhodes Scholars, some people that didn't even go to high school. They went straight to MIT and graduated when they were 16. And so it was really stressful. And then to match into derm, you have to have really high scores. You had to honor everything. And so if there's pass fail honors, and to get honors you have to have 97 and above percentile. So it was really stressful, and I didn't like the stressful part of it, that I always had to honor everything and work so hard and study so hard and all that pressure. But it's definitely worth it. I think it's the most rewarding specialty, and I love the specialty that I'm in. So that's why sometimes when when you see other people practicing dermatology and they claim they're board certified dermatologists, but they're really OBGYNs who just choose to do medical, not medical, but like cosmetic dermatology and things like that, it's kind of like, well, it's just, for the real board certified dermatologists, which is a very small group of people in the country, it's like, we're kind of like, oh, it's kind of, it's just, it's funny when you see another specialty, like kind of try to practice your specialty. Well, thank goodness they're not really doing medical dermatology. They're doing more like injectables and botox and fillers and things like that. But, it is kind of crazy that, I had another patient who came in for me to laser a brown spot, and their dermatologist, said that it was an age spot that needed a laser, and it was a melanoma. So, I was like, we're not lasering this, we're going to do a biopsy, and, probably save the patient's life. So anyway, but derm was the most amazing specialty, and I wanted to go for it, and I lucked out with matching in an awesome program and matching in a derm residency. So, and I'm very thankful for that. So that's a long answer to your question. My timer just went off, but I'm going to spend a little bit more time with you guys. Let me see here. So somebody said there's a dermatologist in Miami who's doing the microcore called Eloqua. Yeah, it probably, if it's a dermatologist doing Eloqua, it's probably somebody maybe, participating in the clinical trials. And that person probably is a esteemed dermatologist in probably a world leader, because it's a very new device. It's not FDA approved. I don't think it's available on the market yet. They're probably doing either the post randomized controlled trials registry, or they're participating in the clinical trials still. So that whoever dermatologist, it's probably a really a very it's somebody involved in research and a very, esteemed colleague, I'm sure. Okay, I've been missing some questions here. Okay. Let me see. What should we look for in a provider for eye trough filler? So for tear trough filler, you just want somebody who's very comfortable doing it, who's been doing it a long time, someone who can use a cannula. If somebody can't really use a cannula, whether they actually use one on the patient or not, just to be able to be well versed enough to use a cannula is really, really important. So I think that that's one of the main things. You want to make sure that somebody's very comfortable with that area and has been doing it for a long time, knows their anatomy well. I would choose to go to a plastic surgeon or a board certified dermatologist or somebody who knows their anatomy very well, because catastrophic things can happen sometimes when things don't go well, and to be able to reverse it is really important too. You hear these horror stories of people who are probably shouldn't be doing tear trough filler who do, and they have some horrible side effect or blind their patient, and then they call us, the dermatologist, or people who know how to reverse these problems to come in to kind of like clean up the mess, and you don't want to be in a clinic like that. So I would say ask for years of experience, ask for their level of comfort. How long have you been doing this? Do you use a cannula? What product do you use and why? Why do you choose to use that product? Let me see your before and afters. Those are the kind of questions that I would ask, and I love it when people ask me that. So that's my best advice. Okay, options for treating lines around the mouth. Okay, so for treating lines around the mouth, usually fully ablative lasers or non-ablative lasers to resurface that skin is really helpful. Doing a little bit of Botox if you want a less aggressive treatment. A little bit of Botox around the mouth can help relax the muscle that goes around the mouth that causes those lines. Sometimes a little bit of filler, when it's done correctly and in very small amounts, can actually erase the line. So I erase lines, lip lines here. We call them smokers lines. Most people don't smoke anymore, and people who have those lines don't have them from smoking, but it's just from use of your mouth, eating and talking and just living life. But usually I can erase those lines in most of my patients. So just, kind of injecting a little bit of filler around there will help soften those lines as well, with really, really beautiful and natural looking results. Okay, let's see. Let me see. Okay, I'm in love with your products. Is it okay to put your retinol RX on after I use the Zeo Firming Serum, Daily Power Defense, and Bridal Life for my night routine? I'm so glad that you love the products, and thank you so much for sharing that. And yeah, you can put your retinol on after all the Firming Serum, the Daily Power Defense, and your nighttime routine. So the RXR retinol can go on last, and that's totally fine. And it can be mixed with stuff too. Like you can mix it with a hydrator or a hydrator of your choice, or the growth factor serum. So yeah, it's okay to mix that, and it won't destabilize it or anything. Any untinted sunscreen that can block blue light? That's a great question, and the answer is no, only because you need the iron oxides. Mineral-based sunscreen blocks it a little bit, but you need the iron oxides in the sunscreen to block the HEV blue light and the visible light and infrared from our devices. So it always gives the sunscreen kind of like a bronzy color because of the iron oxides. So unfortunately not, but some are less tinted than others. I don't know if you've used just a regular straight up Color Science face shield, that's the non-flex kind. That one tends to blend in with all skin tones, types 1 through 6, and that has iron oxides in it too. Tizo's another really good one too, but it doesn't, Tizo 3, but that one has like a brownish kind of moussey texture. I love it, but it is a little bit tinted from the iron oxide. So unfortunately, no. Okay, let me just try. I'm totally behind on all these. I'm so sorry. Somebody says this is fascinating. I'm glad you find it fascinating. I could talk about this all day. Okay, my friend had it. Oh, okay. I think this is somebody in response to the dermatologist in Miami who's I want the microcoring device. That's amazing that person got it. Okay, let me see. Oh my gosh, this is giving me a hard time. Hold on. My friend had it done by a provider in California a few months back and is flying to Miami to have a second treatment. She said the results are amazing. Yeah, that microcoring device, the Eloqua, is going to be something else once it's available. And if there's somebody who's doing it that you can get to their office to have it done, then definitely go for it. I think that it's going to be an amazing result. It was created and engineered by Roxy Anderson. For those of you who don't know, Roxy Anderson is one of the giants in dermatology. He's an MD PhD. He's brilliant. He's a genius, and he's the nicest man ever. And I remember he interviewed me at Harvard for my residency interview, and I was so nervous and I was so starstruck when I saw Rox Anderson. I couldn't even say my name. I was like stuttering and was just as a loss for words when I met him. But Rox Anderson is the brains behind Eloqua, which is coming out soon. He's also the inventor of Fraxel, pulse dye laser, cool sculpting. I mean, anything that comes from Dr. Rox Anderson's brain is going to be amazing. You know, it's going to be amazing technology. So that's coming down the pipeline. It's so funny. I tell that story to everybody, and it's like, you know, I went to UCLA where we'd see like influencers and A-listers and celebrities walking by all the time, and it would never faze me. But when I would meet like giants in dermatology who have contributed to the field of dermatology, and when I first met Dr. Suzanne Kilmer, who was my fellowship director, I got tongue-tied and I got so nervous I couldn't even speak, just because these people have these brains that are just so amazing, and I'm just blown away by them, that when I meet them I can't talk for some reason, and I don't get starstruck with normal people, or that which should probably be making me more nervous. But anyway, so yeah, it's a Rox Anderson discovery and innovation, and it's going to be amazing. So I'm glad to hear that feedback, that somebody had it done recently and the results were amazing. Okay. So can you share the amount of sunscreen we're supposed to wear, and how much, and how often we should reapply? Any tips with zinc SPF? I look like a hot mess at the end of the day. So I mean, it depends on how diligent you want to be. You definitely should put your base layer of sunscreen on in the morning, and then, you know, reapply it. If you're outside, I mean, I set a timer on my phone to reapply it every 2 hours when I'm outside at the beach with my kids, but I'm neurotic and OCD about my skin. I wouldn't expect you guys to, but you know, it's good to reapply it every couple hours when you're outside, if you're even by a glass window, and it's easier to reapply sometimes when it's in the powder form. So that's why I love the color science. And again, I'm not in contract with any of these companies. I just recommend what I like. I have no ties to any company. I have no ties to color science. I just like they have a brush with a mineral SPF that's easy to apply, you know, over your makeup, over your serums, because you put on your, you know, your skincare routine, your serums in the morning, then you put your sunscreen on, and throughout the day you can just dust on some, you know, powdered mineral SPF, keep it in your purse, your car, your backpack, at the office, and that's a good way to reapply. So you won't look like a hot mess, and it's better to be a hot mess with zinc oxide sunscreen on your face than to be old, you know, weathered skin when you're like, you know, in your later years. So I think that's my best tip, is to put on a good base layer in the morning and then reapply with a powder sunscreen. That's what I do. Thank you for thanking me for sharing my story. It's fun talking with you guys. Okay, how often should you switch up your face cleanser? I've been using mine for a long time, like years. I mean, your face cleanser is not as important as switching up some of the products in your skincare regimen. I don't think that if you have a cleanser that you like and you're using it, I think that's fine. I think it's more important, like your antioxidants or your growth factors or your AHAs or your retinol or vitamin A derivative that you're using. I think that's more important to switch up like every couple months as needed. But the cleanser, if you like a cleanser and you're using it, I think it's totally fine to stick with it. Okay, interested in getting rid of lines across my neck, but not interested in surgery or fillers. I just left with topical. So if you're talking about like the tech neck creases, so Thermage, I actually just did a video on YouTube did I post it today? Yeah, on neck creases. I posted it today if you want to check it out. Botox along the little horizontal lines in the neck will help relax that skin and help get rid of that the horizontal bands, which we call tech neck. Radius, which is an injectable filler, can definitely help with erasing those lines too. And then Thermage is another energy-based device that helps tighten that neck skin, help with the horizontal bands. And I've done Thermage to myself too. I haven't ever done Radius or Botox, but even if you look at, I left them up, but if you look at my earlier YouTube videos, I look like a hot mess because I'd never been doing these treatments on myself. I was like in my 30s, and you know, I had neck bands and all these things, and you know, now that I'm in my 40s and I'm doing these treatments on myself, it's gone away. So Radius, which is a stimulant filler, is a great one, and then also Thermage is a tightening device that helps tighten neck skin, and that's the one that has saved me, that I really, really love a lot. So those are things that you can do, but using serums and using, you know, neck serums can help. It just depends on how severe it is. If you're 25 with anatomical tech neck, I think that, you know, serums will be enough for you. But if you're like 45 and you're starting to get these little creases, I would do either Thermage, which stimulates collagen from within to lift, tighten, and pull, or I would do a little bit droplets of Botox to see if that works for you, or you could do a stimulant filler like Radius, which stimulates your fibroblasts to make collagen and elastin to kind of remove those little etched in horizontal lines. Okay, let me see. Can we do something about marionette lines at home? It's for my mom. You're so cute. So these are the marionette lines, and unfortunately at home there's really not much that we can do for those. That's usually more of like you need to pull from up here with either filler or a thread lift or a tightening device, or use a little bit of filler to fill in those lines. So unfortunately, I'm sad to tell you no, but I mean, if there's anything you can use at home, I'm all about telling you guys. But unfortunately, there's not. Otherwise, everybody would be using it and people would be talking about it on social media, I'm sure. Okay, let me just go here. Okay, thank you so much. Our stem factors the same as growth factors? They are. So peptides, stem factors, growth factors, they're basically just signaling intracellular communications that cells use to talk to one another. So usually like in some type of wound healing environment, say you have like a burn, and your cells release all these mediators, make collagen, make elastin, recruit the macrophages, your immune system to come and eat away all the scar tissue. There's a lot of things that happen. So skincare products usually harvest these growth factors and put them into skincare products. But polypeptides and anti-aging peptides are actually pretty much the same thing, but instead of being naturally derived, I think like the TNS essential serum from Cosmetic is derived from human, tissue. It's actually penile foreskin, but the Zeo Skin Health growth factor serum is plant derived, and then in my NMF hydrator, MD Air, it's actually polypeptides that are engineered in a lab to be smart growth factors that are synthetic, that are going to do the same thing, tell your cells to make collagen, make elastin, increase cellular renewal, all the things that we want that our skin to do to look healthier and more vibrant with better texture. So stem cell factors and growth factors are pretty much the same thing, and so are polypeptides too. Certain anti-aging polypeptides are too. So yes, they're all pretty much the same thing, and they have different names, which can kind of be confusing. Somebody asked, hold on, let me see. Okay, what is the best way to get rid of blackheads on the nose? I would stop using oils, any facial oils, if you're using that to start with. I would recommend the Zeo Getting Skin Ready protocol, where you have your cleanser, your exfoliating polish, and your complexion renewal pads. Remember, when you look at blackheads are just open pores that are filled with gunk that gets oxidized. That's why it turns black. And so you need to remove the gunk so that the pores can close. The pores can't close when they're filled with stuff. So things that loosen up the debris inside your pores is one step, and then shrinking down the pores to eliminate those blackheads is another. So if you wanted to do it from a skincare approach, you could use a cleanser, some type of exfoliant, and a toner. If you wanted to do it with lasers, a clear and brilliant or a Fraxel laser on the nose definitely gets rid of blackheads and shrinks pores. It gets rid of blackheads by shrinking the pores, and usually patients who are getting these procedures, I already have them on a protocol to deep clean out the pores, so that when we cinch down the pores, it's kind of like a purse string. It's going to cinch down the collarette of collagen, holding open the pore so it just closes down, but it can't close if there's debris in it, just dead cells and sebum and keratin, things like that keep the pores open. Okay, let me just see. Okay, plastic surgery scars, when's the optimal time to have laser treatment over it? Which laser would be ideal? Usually I say 6 weeks. The boards ask us on the boards, and the answer is 3. In reality, it's usually 6 to 8 weeks. It depends on what the scar morphology is. So if it's a reddish scar, if the scar is kind of red, V-beam would be your laser. If it's a textural thing, like it's kind of firm and kind of dimpled and kind of like, with the topography, texture irregularity, it'd be Fraxel. If it's a hyperpigmentation, like hyperpigmented scars, like C-section scars or things like that can be hyperpigmented, I would use like a Pico or a YAG. So it just depends on what morphological change does the scar present with to determine what kind of laser would be used to treat it. And usually it's more than one laser treatment. Usually it's like 2 to 3 laser treatments. Let's see. Okay. Marionette, it's so good to see you guys. Thank you. I have to hop off, but enjoyed this so much. I enjoyed having you guys on here too. Tips for avoiding folliculitis on legs when you live in a humid place. Oh, I would say just with shaving, just be really careful. The more blades you have in your razor, the more bacteria can hide inside the spaces in between the blades. So I would get if you can get a fresh blade each time, which is very hard to do and expensive, or get one with like outfit. Like I remember when I used to shave my legs, you know, before I knew about this, I'd have like 10 blades in my razor, but the less blades you have, the less bacteria live there, and yeast and all the things that can cause a folliculitis, which is just inflammation of the hair follicle. And then just make sure that, you know, you wash really well before you put on your shaving cream if you use it, and shave your legs. And then what else? And then, I mean, laser hair removal is always best, by getting rid of the hair just permanently with a laser instead of having to shave it, because it's the shaving that causes the folliculitis, or the inflammation of the hair follicle. Okay, random question, but does anyone know if it's okay to use expired tretinoin? I probably wouldn't. If it's more than a year, I would just toss it and get a new one. It's not worth the risk of, you know, irritation or breaking down of the product that can cause your skin to be irritated. Somebody asked if I ever thought of starting a podcast. Maybe I should. I don't know. If you guys think I should, I will. I'm busy enough with Instagram and YouTube. Oh my gosh, and seeing patients every day. It's so hard to keep up with everything, but that podcast might be fun. Okay, what do you recommend a good sunscreen and ingredients for face, body, and lips? So sunscreen, so sunscreens for face, body, lips, I mean, always, you know, the mineral base, zinc oxide, titanium dioxide are always best. And then using the same protective factors on your, you know, on your lips and your body is really important too. So I think zinc oxide, titanium dioxide always. And then for the lips, I mean, even Color Science makes a lip balm, but any of the, like Sun Bum has it. I think they may have like chemical sunscreens in their lip SPF. I'm not really sure, but whether it's the skin on the lips, the face, or the body, it should be a mineral-based sunscreen. Okay, last question. I got through all of them, you guys. Okay, can Fraxel Truly help with wrinkling under the eyes? Yes, and I've been doing it since I was like 22 years old. So Fraxel helps resurface the under eye area. You can see right here, and it stimulates collagen and elastin synthesis. Your under eye area is the first to lose collagen and elastin over time, and so that's what gives it kind of like that crepey look. So when you tighten it up by stimulating collagen and elastin in it, it just gives it a bright, fresh, smooth look that, you know, basically will protect you from having that crepey, loose, wrinkled skin later on. I mean, it's going to eventually happen, but it'll significantly slow it down. So people, for preventative measures, do Fraxel sometimes to prevent fine lines and wrinkles from happening under the eyes. People who already have fine lines or wrinkles under the eyes and want to reverse it, it may take several other treatments. It may not ever go away completely if they're pretty severe. Then that person may need surgery, unfortunately, but it definitely can make it look better. Okay, so I think I got to all your questions, you guys, and good night. It was so good to see you. I'm probably going to post this so you guys can watch it later if you found it useful. I'm not sure if I will or not, because it's kind of, I don't know. I'm going to do this every week, so I'll be on every Sunday, and I'm here to answer your questions. But love you guys, and oh gosh, you guys are so sweet. Thank you so much. One last question. If vitamin C has not worked for someone before, could it just be the wrong one for them? Yes, vitamin C is highly dependent on the formulation and a lot of other factors that go into a formulation. So if it didn't work for you, try another one. You should try mine. I think you're going to love it. It's fire. Okay, you guys, I love you. Good night. Happy Sunday.